Do you ever wonder why some women experience difficulty with sexual functions? It's not an uncommon question, and the answer lies in a condition known as female sexual dysfunction, or FSD for short. This issue, often shrouded in silence, is surprisingly prevalent, affecting numerous women across the globe. FSD encompasses a range of problems related to sexual health, from lack of desire to pain during intercourse. It's not just a physical condition, it's a complex interplay of psychological, emotional, and physiological factors. But here's the good news. It's not a dead-end road. There are numerous treatment options available and many strategies that can help women cope with FSD. In this video, we'll take a deep dive into the labyrinth of FSD, exploring its causes, treatments, and coping strategies. We'll help you unravel the mystery of this condition, providing a clear and comprehensive understanding of it. Knowledge is power, and understanding FSD can help women navigate through it more effectively. A female sexual dysfunction, or FSD, is more than just a simple issue. It is a multifaceted condition that affects many women across the globe, encompassing a range of symptoms and experiences. To better understand FSD, we can categorize it into four main types: desire disorders, arousal disorders, orgasm disorders, and pain disorders. Firstly, we have desire disorders. This is when a woman experiences a lack or absence of sexual desire or interest in sexual activity. It's not always about being in the mood. Desire disorders can often be a persistent issue that impacts a woman's overall quality of life. Next, we come to arousal disorders. This refers to the inability to become physically aroused during sexual activity despite having the desire. This can be a frustrating experience, as the mind might be willing but the body seems unresponsive. Thirdly, we have orgasm disorders. This is characterized by a persistent difficulty or inability to reach orgasm after ample sexual arousal and stimulation. It's not about achieving orgasm every time, but more about the continued struggle to reach climax that can lead to distress. Lastly, we have pain disorders. This is when women experience pain during intercourse or other sexual activities. This can range from mild discomfort to severe pain, and can have a significant impact on a woman's ability to engage in and enjoy sexual activity. However, it's essential to remember that FSD isn't just about the physical aspects. Psychological and emotional factors such as stress, anxiety, and relationship issues can also play a significant role in FSD. It's not just a body issue, it's a whole person issue. FSD is a complex condition, but it doesn't have to be a life sentence. There are many resources, treatments, and strategies available to help manage and overcome FSD. Understanding the condition is the first step in seeking help and finding solutions. So let's delve deeper into the causes of FSD in our next segment. Now that we know what FSD is, what causes it? The causes of female sexual dysfunction, or FSD, are as diverse as they are complex. They can be broadly classified into three categories: physical, psychological, and sociocultural. Let's start with the physical factors. Hormonal imbalances, particularly those related to the menstrual cycle, pregnancy, childbirth, and menopause, can significantly impact a woman's sexual health. These hormonal shifts can lead to decreased libido, discomfort during intercourse, and other symptoms of FSD. Diseases such as diabetes, hypertension, and neurological disorders can also contribute to the development of FSD. It's crucial to remember that any physical condition affecting blood flow, nerve function, or hormonal balance could potentially impact sexual health. Next, we look at the psychological factors. Stress and anxiety can play a significant role in FSD. When the mind is preoccupied or distressed, it can be challenging to feel relaxed or aroused. Issues like depression, body image concerns, and past traumatic experiences can also lead to FSD. Mental health is a critical aspect of sexual health, and it's important not to overlook its impact. Lastly, we delve into the realm of sociocultural factors. Societal expectations and norms, relationship issues, and lack of sexual education can all contribute to FSD. Women often face immense pressure to meet certain sexual standards, and this can create anxiety and inhibit sexual desire or response. Poor communication with a partner about sexual needs and preferences can also lead to dissatisfaction and dysfunction. In a nutshell, FSD is a multifaceted issue with a multitude of potential causes. It's not as simple as one might think, and it's certainly not about not trying hard enough or not being good enough. It's a complex interplay of various factors that can affect any woman at any point in her life. It's important to remember that FSD is not a fault or failure. It's a health issue that can be addressed. Understanding the causes is the first step towards seeking help and finding appropriate treatment. Stay tuned as we explore the treatment options for female sexual dysfunction in our next segment. So FSD has a cause, but what about a cure? This is the question that many women often find themselves asking. And the answer is yes, there are several treatment options available for female sexual dysfunction, or FSD. Let's dive into some of these, shall we? First up is hormonal therapy. This involves the use of hormones to balance out any deficiencies or excesses in the body. This could involve estrogen, testosterone, or a combination of both. Hormonal therapy can be particularly effective for women experiencing FSD due to menopause or other hormonal imbalances. Next, we have physical therapy. This might sound a bit surprising, but it's true. Physical therapists who specialize in pelvic floor disorders can provide exercises and techniques to help improve sexual function. This can be beneficial for women who have FSD due to physical conditions like pelvic floor dysfunction or pain during intercourse. Psychological counseling is another valuable treatment option. FSD can sometimes be linked to psychological factors such as stress, anxiety, or past traumatic experiences. Working with a counselor or therapist can help address these underlying issues and improve sexual health. Lastly, let's not forget about lifestyle changes. This can involve a range of things from improving diet and exercise, reducing stress, quitting smoking, or limiting alcohol intake. These changes can help improve overall health, which in turn can have a positive impact on sexual function. But here's the thing to remember. The best treatment plan for FSD often involves a combination of these options. It's about finding the right balance that works for you and your body. That's why it's so important to work closely with your healthcare provider to devise a treatment plan that addresses your unique needs and circumstances. And this brings us to our final point. Remember, there's no one-size-fits-all solution. What works for one woman may not work for another. The key is to keep exploring and trying different options until you find what works best for you. After all, every woman deserves a fulfilling and satisfying sexual life. Living with FSD can be challenging, but there are ways to cope. Coping with female sexual dysfunction, or FSD, is not just about medical treatments. It's also about implementing strategies that promote overall well-being and health. Let's talk about some of these strategies. Firstly, open communication with your partner is vital. This is about more than just expressing your needs and concerns. It's about fostering a relationship where both of you can talk freely about sexual health without fear or embarrassment. This open dialogue can lead to greater understanding, empathy, and a stronger bond. Secondly, don't hesitate to seek professional help. This can come in the form of a medical professional, a therapist, or a support group. Medical professionals can provide treatments and advice based on your individual situation. Therapists can help you manage any emotional or psychological aspects of FSD. Support groups, whether in person or online, provide a community of people who understand what you're going through. You're not alone, and reaching out to others can be incredibly empowering. Finally, self-care is crucial. This includes physical self-care, like maintaining a healthy diet and regular exercise, but also mental and emotional self-care. Engage in activities that make you happy and help you unwind. Practice mindfulness techniques to help manage stress. Prioritize sleep. Remember, your overall health and well-being can impact your sexual health and vice versa. In conclusion, creating a supportive environment for yourself is key. Surround yourself with understanding and caring individuals. Don't be afraid to seek help when needed. Remember that it's okay to talk about your sexual health openly and honestly. FSD might be a part of your life, but it doesn't define you. With knowledge, help, and self-care, you can navigate through it successfully. And always remember, you're more than your sexual health. You're a whole person with strengths, passions, and a life beyond FSD. It's just one part of your journey, and with the right strategies, it's a journey you can navigate with confidence.